A heart attack is a deadly medical emergency where your heart muscle begins to die because it isn't getting enough blood flow. A blockage in the arteries that supply blood to your heart usually causes this. If a healthcare provider doesn't restore blood flow quickly, a heart attack can cause permanent heart damage and death. If you suspect you or someone else is experiencing a heart attack, it's crucial to seek emergency medical attention immediately. Common symptoms of a heart attack may include 1. Chest pain or discomfort. This is often described as a feeling of pressure, tightness, or squeezing in the chest. The pain may radiate to the arms, usually the left arm, neck, jaw, shoulder, or back. 2. Shortness of breath. Difficulty breathing or a feeling of being unable to catch your breath may occur. 3. Nausea or vomiting. Some people may experience nausea or vomiting during a heart attack. 4. Sweating. Profuse sweating, often described as a cold sweat, can be a symptom. 5. Light-headedness or dizziness. Feeling lightheaded or dizzy may occur, and in some cases, people may faint. 6. Fatigue. Unexplained extreme tiredness or weakness can be a symptom. It's important to note that symptoms can vary, and not everyone experiences the same signs. Additionally, women may sometimes have atypical symptoms, such as discomfort in the jaw, back, or neck, as well as nausea or extreme fatigue. When a heart attack happens, blood flow to a part of your heart stops or is far below normal, which causes injury or death to that part of your heart muscle. When a part of your heart can't pump because it's dying from lack of blood flow, it can disrupt the pumping sequence for your entire heart. That reduces or even stops blood flow to the rest of your body, which can be deadly if it isn't corrected quickly. The vast majority of heart attacks occur because of a blockage in one of the blood vessels that supplies your heart. This most often happens because of plaque, a sticky substance that can build up on the insides of your arteries, similar to how pouring grease down your kitchen sink can clog your home plumbing. That buildup is called atherosclerosis. Sometimes, plaque deposits inside the coronary, heart, arteries can break open or rupture, and a blood clot can get stuck where the rupture happened. If the clot blocks the artery, this can deprive the heart muscle of blood and cause a heart attack. Healthcare providers usually diagnose heart attacks in an emergency room setting. Anyone with heart attack symptoms should undergo a physical examination, including checking pulse, blood oxygen levels and blood pressure, and listening to heart and lung sounds. Treating a heart attack means restoring blood flow to the affected heart muscle as soon as possible. This can happen in a variety of ways, ranging from medication to surgery. In general, there are many things that you can do that may prevent a heart attack. However, some factors beyond your control, especially your family history, can still lead to a heart attack despite your best efforts. Still, reducing your risk can postpone when you have a heart attack and reduce the severity if you have one. In general, your heart attack symptoms should decrease as you receive treatment. You'll likely have some lingering weakness and fatigue during your hospital stay and for several days after. Your healthcare provider will give you guidance on rest, medications to take, etc. Recovery from the treatments also varies, depending on the method of treatment. The average hospital stay for a heart attack is between 4 and 5 days. Recovery from a heart attack after leaving the hospital depends on the severity of the heart attack, how soon treatment began, the methods used, and the health conditions you had, if any, before your heart attack. Your healthcare provider can explain the next steps for your recovery and what you can expect. In general, most people can return to work or resume their usual activities anywhere between 2 weeks to 3 months after their heart attack. Cardiac rehab can help people gradually and safely increase their physical activity back to its prior level. New heart attacks happen to about 635,000 people in the US each year. About 300,000 people a year have a second heart attack. About 1 in 7 deaths in the US is due to coronary heart disease, which includes heart attacks. A note from Cleveland Clinic. A blocked artery needs immediate care to prevent permanent heart damage. You may think that if your symptoms aren't intense and severe, you're not having a heart attack. However, it's best to get your symptoms checked. Calling 911, rather than driving yourself or having someone else drive you, can be even more life-saving than you think. Time saved is a heart muscle saved, and that means you have a better chance of a good outcome.